It's just frustrating, disgusting, heartbreaking.
That Willimantic woman is talking about the months-long battle with her insurance company. You see, she's been trying to get approved for a potential life-changing surgery. Consumer investigative reporter Jennifer Joas explains how our response team was able to help.
I'm not getting better.
Melissa Vargas can't button her own shirt, can't hold utensils and cut her food.
Nothing's going to change.
Can't even wrap her arms around her granddaughter.
I can't do anything that you need two hands for.
She has limited mobility in her right arm after suffering from a stroke 4 years ago. In July of 2025, she thought there was hope when one of her doctors recommended she get a Vivastim implant. It's an FDA-approved device that could help stimulate the nerves in her arm and help her regain mobility. Vargas says she went through rigorous occupational therapy and tests just to qualify.
It's approved by Hartford Healthcare, and the insurance company is like, no.
Her insurance company, Anthem Blue Cross and Blue Shield, denied the surgery.
It's been devastating. I didn't expect them to say no because it's so life-changing for me.
In a statement, an Anthem spokesperson wrote, "In this situation, the vagus nerve stimulator wasn't approved because it's currently only recommended for treating epilepsy. But the FDA approved the implant for stroke survivors in 2021, so Vargas appealed. Anthem denied her again, she said, for a risk of infection and not enough long-term data. She then requested an external review, and Anthem denied her a third time. Anthem wrote, an independent review organization upheld our original decision, citing a lack of published scientific evidence to support the effectiveness of this implant for strokes, particularly in the long term.
How are you going to get long-term data if you don't approve people to have the surgery and follow up after?
Vargas is not only a patient at Hartford Healthcare, but she also works there as a case manager.
I work full-time. I pay my premiums. If two doctors are saying that I can benefit from this surgery, they should be approving the surgery. My whole life has changed and everything is completely different. I just feel like they're fighting me every step of the way.
But Vargas was determined and went directly to her HR department at Hartford Healthcare. We also reached out to Hartford Healthcare on her behalf.
I was very honest in my email that I had reached out to you guys. I had already interviewed with you guys. I'm like, I had no more options.
After we reached out, Vargas says Hartford Healthcare gave her the go-ahead as her employer to get the surgery. Anthem said they didn't foot the bill, but Hartford Healthcare did. They said they covered it under their benefit plan. In a statement, Hartford Healthcare wrote, "We are proud to offer innovative procedures like Vivastim and are encouraged by the promise it shows for patients." Weeks after getting approval, Vargas underwent surgery at Hartford Hospital.
My strength is improved. Before the surgery, I could only squeeze 5 pounds, and I can squeeze 12 pounds now. I wouldn't be able to hold it like this, but I can hold it now.
She uses this adaptive fork to cut her food with the help of this small magnet. It activates the device near her shoulder, and she spends hours a day doing repetitive motions with her hand and arm. But what she's most proud of,
one of my big goals was to hug my granddaughter with both arms, and I did. Thank you. Thank you for listening. Thank you for agreeing to interview. Thank you for your hard work behind the scenes.
Vargas says that she would encourage anyone out there battling their insurance company to be persistent. Use any resources you can think of and advocate for yourself. For NBC Connecticut Responds, I'm Jennifer Joas.